Hey guys, welcome back. I want to talk today about one big misconception about hospice care that I have seen just everywhere, especially in my 20 years of medical practice. And that is you're basically giving up. So let's get into that today. Hi, my name is Abigail, here to normalize these conversations and education about death and dying so we die better at end of life. Let's get into it today. I heard this a lot, not just when I was in hospice and palliative care working for about 15 years, but also when I worked mainly in the hospital, oncology, and ICU. And when people started to talk about hospice, whether it was a family or even with some medical staff, I would hear these phrases not just from family members and loved ones, but also from medical professionals saying, yeah, so you're basically just giving up at that point. And it's really an unfair thing to say because it's not accurate. And it really gives the wrong impression about hospice and palliative care. I want you to think about an example. So say you got a pneumonia, say you developed pneumonia, and you had a medical assessment, and the medical assessment deemed that the appropriate thing was for you to be treated by a pulmonologist. A pulmonologist is a doctor that specializes in the lungs, okay, and the lung systems. So the recommendation was that you go and you get care from the pulmonologist for this pneumonia, because also maybe you might have had a history of TB or maybe what else, whatever it is. We'll just keep it really simple. So you go to that specialist. You don't go to a kidney doctor because you have an issue with your lungs right now. You may go to a kidney doctor for some other reason, to address some other kidney related issue. So you'd see a nephrologist or a renal specialist, which is a kidney specialist, but you would go to the appropriate care for that issue, which is the lungs, and you have your pneumonia, say it's a complicated pneumonia, whatever it is, it's a pneumonia, and you go and you get assistance from and proper medical care from that pulmonologist, from that lung doctor, that lung specialist, that lung medicine provider. The same goes with end-of-life care. So when people say, oh, end-of-life care, you're giving up, you're not doing aggressive treatments anymore, there is so much there that we need to unpack. First of all, the aspect or that saying of you're giving up is really, really confusing for many people, because the giving up comes from the loss of hope, and the loss of hope for a physical cure. We have talked, and I've done a video about reframing hope. So this is where you're actually going to be reframing hope and adjusting your frame around hope to still maintain hope, even in the very last moments of whether it's about you, whether it's you're the one who has a terminal illness or your loved one has a terminal illness. So there are still ways to maintain hope. That's in another video. And so that is where kind of the giving up kind of comes from, because it's like, oh, the end, and, nothing else, they're not doing anything else, nothing else can be done. So you're just basically giving up if you're going on hospice. And in fact, that is so the opposite. When you're going on hospice is when you're doing a lot more, and I will get to that in a moment. The other thing that I have heard, and this is mainly from medical professionals, they say you stop all aggressive care on hospice. And this is where I really, really want to make sure that we're clear. Aggressive care is aggressive care, treating something aggressively. On hospice, you treat aggressively. You're treating symptoms, you're treating the management of the disease process aggressively, particularly in terms of comfort and symptom management. You are treating those aggressively. What you're not doing is you're not treating them curatively, okay? So you're being really aggressive with making sure that all the issues that are coming up, anything that you've assessed that needs a medical attention, those are aggressively treated in hospice. And that is 100% accurate, okay? So you are being aggressive in hospice. The thing where it's different, though, is that the direction of care is different. It's not curative. You're not trying to cure the physical illness. You are trying to manage it in a way that it keeps the person really comfortable and provides them the highest amount of dignity and quality at end of their life. So it is still aggressive. It is still aggressive treatment, but it's not curative, and that's the delineation. Okay. So to be clear, you are not giving up. You can reframe hope around hospice care, and especially at end of life. The care is still aggressive in nature. The direction of the care, though, is focused on comfort, not curing. So when we do talk about hospice and the value that it brings, it's incredibly, incredibly valuable, because now we're talking about, like we gave in the example about, getting, treating a lung issue and going to a lung doctor and going to a lung medical specialist. This is an end of life issue when you or your loved one reaches the time for hospice care. So you go to the end of life specialist. The connection we have to make is the fact that, okay, we're dealing with grief here. And that's where that whole feeling of, oh, there's nothing more we can do, or there's this and that. You're changing your direction of care. So yes, you're not doing anything more to cure the illness, because there is nothing more. And it's been shown, and it's been medically assessed, that it's no longer futile, or it's at this point, it's futile to try to cure the medical issues. And now it's really time to focus on quality of life, dignity, for end of life. So you go to the proper specialist, you go to the hospice specialist and specialist care team to address all those needs, because they're the right, appropriate people for that. And they do so much more than just give morphine. There is always that thing about, oh, they just give morphine and that's all they do. No, they do so much more. They tackle the physical, the emotional, mental, the spiritual aspects of the person who is at end of life, and also working closely with that whole unit of care for that person, meaning essentially their loved ones. And it can be, whoever their loved ones are, whoever their assigned loved ones are for the person, blood related or not, that doesn't matter. It will include things like legal decision makers and helping you sort through all that. So hospice does so much more than just, like I said, give morphine, because it is tackling all those issues around end of life. So you really want an end of life when that time comes and the medical team says there's nothing more that they can do from a curative standpoint, and they do refer you to hospice or your loved one to hospice. That is the best, most loving, most appropriate level of medical care that you can be getting for you or your loved one. Let me know if you have questions. Let me know if I need to clarify anything else. My name is Abigail. We'll continue normalizing these conversations in education about death and dying so we die better at end of life. I'll talk to you soon.